Hello, Dr. Vicki Peterson here. I was looking over my Facebook group, Hiatal Hernia Solutions, and there's a lot of questions, which of course I'm not surprised because we literally hear from people all over the world with this problem. So it is close to an epidemic, I would say, in that there's so many different facets of it. It's so misdiagnosed, underdiagnosed, and of course one of the common questions that is asked is, what do I take? You know, what drug do I take? Or even a natural solution, what vitamin can I take? And of course it's normal, especially in our medical model, to look for the one fix, right? I've got this, what do I do for it as a single entity? And that's not the answer. So I want to go into why what we do is different, and why just the drug is not going to really do what you want it to do. So let's look at the two most common medications that people with hiatal hernia are offered. The most common is antacids of various types. There's a lot of different antacids. And of course this comes from the fact that one of the predominant symptoms associated with hiatal hernia is that the stomach is squeezing and inappropriately shooting the acid that should be residing in the stomach up the esophagus, so you have heartburn or acid reflux, and it can be pretty miserable. There's no two ways about that. You can get a hoarse voice, it can mimic chest pain, it can mimic a heart attack and interrupt sleep. So, you know, this is something that will get your attention. And the conventional medicine model is, there's acid in your esophagus, that's inappropriate, let's put you on an antacid. On the face of it, that can make sense. However, it's a terrible idea. So, why? Your stomach is really your first area in which digestion takes place. So you chew your food, but then it just goes down the tube called the esophagus, and it gets into the stomach, which is literally a bag of acid. It's designed to be that because requires that hydrochloric acid to break down the food. Now, as soon as you're put on an antacid, you have squelched the ability of the stomach to do that first step of digestion. So from the get-go, as soon as you're doing that, you have maldigestion, malabsorption, because it's an interesting sort of cascade that occurs in the digestive tract, which is that when the broken down food leaves the stomach in a normal digestive process, then it's of a size, it's being broken down by that acid, and now the enzymes in your small intestine and bile from your liver and gallbladder get to work, and it's all predicated upon step one has to occur properly before step two, before step three. So as soon as you're on that antacid, step one doesn't occur, and there's just really no way for proper digestion to then occur, which sets you up for a whole cascade of problems of malabsorption, maldigestion. You're not absorbing your nutrients. So that is a problem. There's also some dangerous side effects associated with long-term antacids, and I'm not going to go into that right now, but suffice to say, you're not supposed to be on them for any length of time because of known dangerous side effects. So there's that. Now, if you're someone whose hiatal hernia has given you anxiety, things like heart palpitations, you feel anxious, okay, which is a very common symptom, then that anxiety, as soon as they figure out, and if you've had this for a while, you've undoubtedly visited an ER, and to make sure that you're not having a heart attack, or the anxiety or panic attack can be very overwhelming. They love to occur in the middle of the night, which is of course even more scary. And what you're told after an evaluation is it's just a panic attack. And then you're given a dangerous psychiatric drug, an anti-anxiety, antidepressive drug. So the problem with those is, again, very known dangerous side effects of having suicidal tendencies, suicidal thoughts. These are not innocuous drugs by any stretch of the imagination. So there are your two drug options, neither of which A is going to correct the problem, and they're going to create more problems. So the what do I take when it comes to conventional medicine, there are no good options really that are being offered to you.